on the occasion of World Mental Health Day, which is observed on 10th of October, let us have a conversation around why mental health is such an important and vital aspect of our well-being. I'm Swathi here from Samatvalife, and with me today is Dr. Meena, who is the professor and head of Mental Health Education Department from NIMHANS.
Thank you, Swathi, for inviting me for this important conversation around mental health.
Thank you so much, Dr. Meena, for taking time off to give us more detail about why is mental health such an important aspect today, and what is it that we need to understand more about mental health?
Swathi, I would like to say that mental health is doesn't have the same place of importance as how physical health has. Like for example, if someone is having a physical condition, we immediately take them to a hospital, and there's a lot of care that is given by the professional, and the family is also compassionate towards them whenever someone is having a physical condition. But unfortunately, it is not the same when a person complains of anxiety or depression or any other mental health conditions, or even mental health crisis when someone undergoes. So I think it's very important for us to actually dispel these myths that surround mental illness that the people in the communities have. And I think, we need to have real conversations, because mental health is a very important aspect of physical health. So they go hand in hand. You can't separate mental health from physical health. And it's very important that, both need to be addressed equally.
And to understand a little more about what are the symptoms that we can see, because in everyday life, sometimes we don't know how whether somebody is going through this mental health condition. Some few symptoms that if you could put it across so that our audience will also know how they can gauge whether somebody at home is going through this tough condition.
Yeah, so Swathi, I think if you look at, there's a very range of mental health conditions, what we call as from minor psychiatric disorders to very severe mental health condition. What immediately, brings to our attention, that we need to focus on is that, if we see someone, with, low mood, or, there's some kind of crying spells, there's some kind of death wishes, or, if the person is withdrawn for some reason, he is not communicating adequately, or and there are some oddities in behaviors, like if he's talking to himself, he's laughing to himself, or there is some incoherent speech, or the speech is little inappropriate. There could be very many such signs which can tell that there's something visibly wrong here, and the person could be actually suffering from some kind of a mental health condition, and that which needs to be brought into immediate attention. So these are, some of the things that one should, observe in a person whenever there's sudden crisis also. And it is very important that one needs to, bring it to the attention of maybe the doctor whom they know, or to a mental health professional. And it's very important that they seek the help, and the person gets the required help and care that is needed.
Thank you so much, Dr. Meena. It's really insightful, and we surely should look into all these points. Over the years, in conversation with people, we have observed that people talk about physical ailments very comfortably. Like it could be diabetes, it could be hypertension, it could be anything related to physical ailments. But when it comes to mental illness, it has not been understood that much. So can you put a little more insight on why it is not being seen in the same level as a physical ailment, and what is it that we must do to it?
Yeah, so it's very important. I think you have raised a very vital point, Swathi. One would be, because of lack of knowledge that they have regarding mental illness also. And this lack of knowledge will also stem from some kind of a fear that how mental illness is portrayed in the society, and this could be influenced by watching movies or serials, or how media has depicted mental illness over the time. They are sometimes labeled just like caricatures, or some source of entertainments in movies and all. And the way the treatments have been shown, the way mental health professionals have been shown, the way the hospitals have been shown in movies and all, have actually instilled some kind of a fear in the people, in their minds, that mental illness is something very dangerous, and it could be even contagious, or it could be because of some kind of a past karma that the person has done. And so there are a lot of myths that are surrounding mental illness in the society. So we need a very strong scientific evidence to reach these people. The research needs to reach out, has to reach the common person. The fear among people that every person who reports with mental illness will be hospitalized. So that is not the case also. We don't see that happening. So we see many patients here, they just come on outpatient department and then they go back. And not every person with mental illness need to be hospitalized also. So they can come, they can seek treatment in outpatient setting and they can go back also. And that is why we need to have more of awareness programs around mental illness, and that is why we are actually meeting today, actually to break these barriers that people are having towards persons with mental illness. And we need to have conversations around this. And the theme for this year, World Mental Health Day, is changing the narratives. And also it's a very apt team that we both are here today.
I completely agree with you, Dr. Meena. Taking from there, giving them the care, being compassionate towards people suffering with mental health is such a priority today.
Yes.
Because as much as they themselves are going through such a tough time, and when they have so many, when their own people who are, if they don't understand them, it is like they're going into a shell, and that is what we are seeing today. So what are the ways do you think that people who are going through these conditions, what are the options for them to how they can deal with these kind of conditions? If you can just put some light on it.
If a person who is suffering from mental illness needs to avail treatment, there are specific people, professionals who are involved in that. So one has to go to a trained mental health professional whom we call as a psychiatrist, who has a MD in psychiatry, MBBS followed by MD. And then we have clinical psychologists, we have psychiatric social workers, we have trained counselors and all. And they are in plenty. One needs to actually Google and find out that where is the nearest mental health professional in their vicinity. And all these people are actually trained mental health professionals, and who are very good in providing the care and support that the person with mental illness comes along with the caregivers. And there are a lot of treatment options available for every disorder. There are medications that are given, and there are psychoeducation that is done, family education that is done, and there are a lot of therapies like cognitive behavioral therapies that are given to the person. And their family therapy, where even the family is involved in the whole process of along with the patient, who and it is mainly to support the patient in their recovery. And then we see there are a lot of daycare centers, and there are even helplines. Actually, if you look at Telemanas, was launched by the Ministry of Health and Family Welfare, Government of India, and anyone can call 14416 and actually avail the they can talk to a counselor, and and they can get the right treatment also. So, and nowadays, and the newer research is showing how alternative medicines are also helping the people with mental illness. So you yourself are a very trained yoga educator. You have been practicing yoga for a decade and more, and you have worked with many people with who have come to you with anxiety, depression, and many other mental health conditions. And I think you will be also the right person to shed light on how yoga and other Ayurveda and other treatments are actually shown very good progress in when a person has had a mental illness. So I would like to hear from you also, Swathi, how yoga has really worked for persons with mental illnesses.
Definitely, Dr. Meena. Yoga is considered to be one of the oldest practices in India. And it has been over the years and centuries that yoga has been used to relax oneself, be aware of one's own movements and how the mind works. And even today, when we look at yoga, it is one of the best ways and therapies to help us relax the mind, calm down the mind, with focusing on the breathing during the asana practices, focusing on the breathing during the pranayama practices. During meditation, the mind becomes so calm that you feel completely in a bliss. and everyone should know that it is such a easy practice that they can all practice at home. They don't have to go anywhere outside.
That's
So
true.
yeah, at Samatvalife Yoga and Wellness, we do help all the patients with with the right practices, because we have certified instructors. I'm so glad that you took out this topic, and
Yes.
I'm sure that at NIMHANS also you have a
Yes.
research team which is working
Yes.
on yoga, and it is the only yoga therapy center in India which is associated with mental health condition.
Yes, yeah, and I think we do have very structured modules for various disorders at NIMHANS here, and we are working, like what you told, very holistically, that one needs to work.
Yes.
And we need to understand that, mental illness, the road to recovery for a person with mental illness is a combination of many things. It could be pharmacological treatment, it could be psychological treatment, psychosocial support that one requests, and even other therapies like yoga and Ayurveda and all this plays a very vital role in the person's the whole of it and the well-being of it. And it's one of this one for his road to recovery also, I must say.
Thank you so much, Dr. Meena,
Thank
for
you.
this enriching conversation. And it's very important for anybody who is going through this condition, have compassionate family members, friends who understand the condition, and help them deal with this situation.
Yes.
If you can put some more insight and close this conversation.
Okay. So at the end, what we need to see is that, there is help available, and one has to actually reach out, talk to people, and, not shy away from, talking about what is bothering them. It's very important to not withhold what they're suffering from, and have open conversations around mental health, and be very alert to people around you to see if someone is facing a crisis. Do you think, can we reach out to that person and ask just, hi, or how are you? Hope you're doing fine. And, sometimes just hearing those words of compassion will actually go a long way in recovery. So it is very important that all of us, work towards that. And, like the theme of World Mental Health Day, we need to change the narratives around mental health. We need to talk more about positive stories of recovery about persons with mental illness, so that more and more people come forward to actually seek help. And we also need to focus and, work towards seeing that, just like physical illness, mental illness also gets its due importance, and, gets the help, and people get the help that they actually deserve, and they're able to thrive in a society that is, with compassion and care. Thank you.